So yesterday a patient came to my clinic. She was around 45 to 46 years of age. Her complaint was dirty teeth. We did a cleaning. So once the cleaning was done, I told her, you just go and get checked your blood sugar levels. She was very surprised. She told me, why doctor, I'm too young to get diabetic. Please don't tell like that and all of that. But she actually went and get checked her blood sugar levels and she was diabetic. So my point is that your mouth, your oral cavity can show that small symptoms for the big systemic issues. So it's better not to avoid your dentist. It's actually scientifically proven that a lot of systemic diseases shows their first symptom in the oral cavity. It's also said that your oral cavity or the mouth is the gateway to your body. Coming back to this diabetic thing, it's actually bidirectional. So when the blood sugar levels are high, the bacteria which is causing this bleeding gum, all of that, this gum infections, which is actually otherwise known as periodontitis or gingivitis, these bacteria will be increased. So when these bacteria are more, you will have all of these diseases. When you have all of these diseases, it also affects the blood sugar levels high. So it's like circular. And other thing is that, I don't know if you can believe it or not, but it's actually scientifically proven that when you have a very poor oral hygiene and it is not at all treated, these bacteria can enter into the bloodstream and then cause heart attacks. So that is another one thing. Another thing is like when the people are having very low immunity, who are actually vulnerable people, who are hospitalized, they have a very poor oral hygiene. These bacteria which is there in the mouth can be aspirated inside and they can have respiratory issues. So that's another one linkage. And another one which is very common is about the pregnant ladies. Especially when you're pregnant, you will have a lot of vomiting issues and all of that. So you tend to avoid your brushing a little late, or some people might even avoid it, I don't know. So if it is not taken care well, if your oral hygiene isn't taken care well, and if it is poor, it can actually lead to a preterm delivery, a low birth weight delivery and all of that. So it's actually very important to take care of your oral hygiene. As I told earlier, that small symptom which is shown, that small accumulations, that small decay, that small bleeding gum which is shown in your mouth can actually be a sign of a big systemic disease. So if you can get checked that as early as possible and get treated, then why to avoid it?